Aphasia is stroke-induced aphasia anyway, is not a degenerative disease. It's a chronic disease. And so this is something that, it comes as a surprise, right? Somebody has a stroke, which is not planned, and then they may or may not acquire aphasia depending on the location of that stroke. And then individuals go about life.
Also, I think that there's a big push for living well with aphasia, and so we don't hear a lot of the negative kinds of things that we see with the chronic diseases or with the degenerative diseases, because there's such a big push for getting people with aphasia out there to advocate for themselves, get involved with the community, go back to work. And there's also a big push even in therapy, what's called life participation approach to aphasia, where we're really incorporating the patient's values into the therapeutic process so that they can ultimately live well with aphasia.
And one more, kind of thing to add in comparison is ALS. It's a disease, right? An overall full body. It's a disease that's affecting this whole person. Whereas aphasia itself is a consequence of a disease or of a stroke or of a vascular impairment. So a little bit different in that aphasia is kind of nestled inside of stroke, whereas ALS itself is kind of that is a specific population. So one thing that that it's important for people to know is that there's actually differences in gender in terms of the characteristics that we see with stroke. And so oftentimes men will more so follow those characteristics that you mentioned. However, women may show some additional characteristics or may not show any of the characteristics that stroke is really known for. And so that's an important point. And we've actually had experiences here. There's a young woman that we've been in contact with who she had a stroke and she was found at home on her floor, and they, based on the characteristics she was demonstrating, they had assumed that she was intoxicated and that was it. And they took her to the ER, but she wasn't rushed in to be seen. While other stroke patients, she was lucid enough to know that there were other people that were experiencing stroke that were being brought ahead of her because she had already kind of been categorized at, being not as high profile of a need in the ER. Talking about a symbol that is available that signifies aphasia. But in terms of an actual sign within, the speaking community, we're not aware of a physical sign that somebody might use who speaks ASL, for example, but there may very well be a sign for aphasia within the deaf community. And so I think that would be something important to ask people in the deaf community, how they would talk about aphasia, what sign they might use. And I'll take this moment to also point out that aphasia is a language disorder, and so it impacts individuals across all modalities. So even individuals who use sign to communicate, if they have a stroke, they can still have aphasia, meaning that now their signing, their language breaks down. So just as we see in speaking individuals, they may have a hard time with verbal expression and comprehension, individuals who use sign language may then have trouble with signing to express their wants and needs, and also understanding sign when they're communicating with other individuals who sign.
But I think this lends to a really great conversation in that if there is a sign for aphasia, could we not operationalize that sign, make it standardized across speaking and non-speaking, hearing and non-hearing persons with communication disorders? I think ask them, do you have a communication impairment that limits your ability to communicate effectively? I think given the opportunity to say yes or no, a person with aphasia would happily advocate for themselves to let a first responder know that they were unable to communicate.
Absolutely. And many individuals with aphasia actually carry cards with them or have some type of something on their person, some type of ID. It could be a bracelet. I know somebody who actually who was a veteran who had it put on his dog tags and that he wore, so that they had a way, if verbally they couldn't communicate it, to show that they had aphasia. movement, but just slowing down. So it gives that individual with aphasia, if they have some trouble with comprehension, a little extra processing time. Really helpful to also use gestures, writing along with speaking can be helpful. Also showing pictures can be really helpful. So any type of visual supports. And then maybe modifying language a little bit so they're not using unfamiliar or unfrequent vocabulary can also help improve reception of a message.
And then also, whenever communicating with a person with aphasia, when they're having a hard time, the person with aphasia is having a difficult time getting the message out, the first responder can write down what the person with aphasia is saying to validate whether or not it's correctly being understood by the first responder. So using different types of writing and imagery to help get the message in, but also get the message out. I think the best scenario of an interaction between a first responder and a person with aphasia would be where the first responder immediately notices that the person with aphasia or communication impairment has difficulty communicating, and the first responder asks, do you have a communication impairment? And allows the person with aphasia to either show them some type of identification that they have so that they can convey that yes, in fact, they do have aphasia. I think identifying the problem from the get-go without making any presumptions is the best scenario.
My name is Jennifer Colonel, and I had the stroke back in, 2 strokes at least, April 30th in 2015, and on May 1st during my neurosurgery. Before the stroke, I was a professor and clinical coordinator of sonography. I love teaching sonographic physics 1 and 2. That was my favorite class to teach. And I was actually good at that. I have aphasia, difficulty communicating, but people will say, I can understand you. Well, no, aphasia is more than that. So my form of aphasia affects not only talking, but listening, reading, and writing. I'm right-handed, and I can't feel my right hand. So it's been through intensive speech therapy, intensive occupational therapy to use my right hand. I had all of the thoughts that made me me, but I couldn't express them. I couldn't tell my family, hey, I'm here, but they knew that I was there. Because I would follow their directions, and the doctors knew that I was there. But I couldn't talk.
Scrambled speech, scrambled grammar, scrambled pronunciation. I remember the rescue squad confused. What's going on? What's going on? Sirens. Okay, Bella. Okay? Yeah.
Really to spread the word about aphasia, right? We, not just for first responders, of course that's important, and we want first responders to understand that there are people out there with communication impairments, and you know, give them tools for how to interact with individuals successfully. But really from this big picture perspective, we want the world to know. We want people in hospitality to be aware. We want hospitality to be more accommodating for people with aphasia. We want law to be more accommodating for people with aphasia. I've had clients who have had a stroke, after childbirth, after giving birth, and now have a language impairment, and people want to take their kids away. These people are incredibly competent and able to be the wonderful parents that they have planned and set out to be. They have a communication impairment. It's not an impairment of intellect. It doesn't mean that they can't be a loving, responsible, effective spouse or parent or member of society. And I guarantee if you sit and have a conversation with somebody with aphasia, you interact with them, you will see that they are contributing wonderful, exciting, energetic individuals in our community.
It's not. It's not. Look at me. I went through every phase of aphasia. I went through global aphasia to not talking. I went through Broca's aphasia, Wernicke's aphasia, conduction aphasia, mixed aphasia, non-fluent aphasia. Now I'm at fluent aphasia. So I know what this is like.
It is frustrating blocking my thoughts, blocking pronunciation, blocking what it means to you, expression.
The one thing that I want first responders to know is even though we can't communicate, we are smart. We are still there. And when I was in the global aphasia, I think that was the most difficult time to communicate with me because I couldn't talk.
I think the one thing that I would love to see is a more inclusive society that includes people with aphasia in all types of different ways. I would love to see our patients get back to work in some capacity, feeling as though they can walk into a place of employment, fill out an application with some assistance and without judgment, and be able to go back to work, whatever that may look like for them and their family. So I think just inclusion in general is where I really hope to see our world go. We're already starting to see it in the research process. We're including people with aphasia in the research process, having them drive the research questions, which is a beautiful thing. And then also the research outcomes are being presented in a way that people with aphasia can understand them, so they can actually get involved in the research process and understand what research is being done about people with aphasia. So I think we're on the right track, but there's still a lot of work to do.